We know COVID-19 has impacted some of the city's most vulnerable, and that includes those who struggle with drug addiction. Well, Toronto Public Health numbers reveal that overdose deaths have nearly doubled over the last 3 months compared to this time last year. And advocates say that it's showing this pandemic has exacerbated an issue that was already dire in this city.
We're definitely concerned. We're facing two crises at the same time, both the overdose crisis, which has been going on for a number of years now, and it really is affected by the COVID pandemic as well.
The latest numbers from Toronto Public Health are hard to ignore. 25 overdose-related deaths in April, another 25 in May, and 13 in June. The blue line on this chart showing a 90% increase over the last 3 months compared to last year. While deaths are up, visits to the city's supervised injection site are down. 0 in April when the center closed at the start of the pandemic, and a very obvious dip in the month following as physical distancing measures meant they could only use 2 out of 6 booths at a time. In June alone, visits dropped to 751 compared to nearly 3,600 last June.
If people are not able to come in and use with proper supervision, with staff that are trained in how to respond to an overdose and have naloxone and oxygen, they're much more at risk of, an overdose becoming a fatal overdose.
And that isn't the only contributing factor. Public health says isolation may create more opportunity for experimental use. And during the pandemic, both recreational and habitual users may find themselves using alone.
That absolutely will increase the risk of, a fatal overdose because there's nobody there to respond to them.
The pandemic has also meant less access to resources and supports for those in recovery, with many clinics and treatment centers closed. One harm reduction worker points out the pandemic has also meant people dealing with injuries haven't been able to get access to pain medication through walk-in clinics or family doctors.
For myself personally, needed to go see an osteopath, but I had to wait for them to be open. I walked around in so much pain the last 3 months from an injury, and could be a reason why someone might use. One other thing we do know about the demographic of people who are dying, a lot of them are men working in the trades. If you have an injury, maybe you're using pain medication to help you to make it through your job because that's how you make your money.
But both Dodd and Dr. Shaheen agree that the biggest problem leading to fatalities is one that plagued the city long before COVID-19, a tainted drug supply.
Because of the toxic drug supply, when people go to use, they could potentially overdose quite easily, actually, especially if they use opiates and especially if they use street opiates.
And we know that a lot of the drug supply is toxic. It's contaminated. There's high levels of fentanyl. There's other drugs that we're seeing in there. There's a lot of benzodiazepines in opioids that we're seeing that might increase people's, overdose risk.
It's unclear if that, too, has been exacerbated by the pandemic, but advocates agree something has to change. Toronto Public Health has called on the feds and the province to look at safe supply programs, including an injectable opioid program, but that would require funding.
How many overdoses do we need to be reversing and lives do we need to be saving before we actually implement some policies that don't kill people? Some of those policies exist. Those policies that could be changed are the ways in which we criminalize people who use drugs, and we stop doing that.
Now, meanwhile, in British Columbia, overdose deaths have reached a record high for the second time in 2 months. And those overdose deaths in that province have well surpassed COVID-19 deaths since the pandemic began.